No.
Well, I think we're going to see some changes with federal health care reform. I do think we will see a bill this year. I think we will not get everything that we would like to have, but what is most important is that there is a platform that is built so that we can work with what comes out of the Congress, and that in the future we can bring more people into the system if not everyone gets health coverage at the end of this process. The insurance reforms that are proposed are very important. Getting rid of pre-existing condition that has kept so many people from having affordable health coverage. Having caps on the annual out-of-pocket costs, which has caused people to go into bankruptcy because there haven't been any caps. But most importantly right now for the Congress is to look at the question of affordability. You know, this bill originally was over $1 trillion between now and 2019, and that's what came out of the House. But the Senate Finance Committee came out with a bill that was only around $800 billion. But what the American public needs to realize is that when we pull that money out of the cost of the bill, what we're really doing is reducing subsidies and reducing the number of people who will actually get a subsidy to help them buy health insurance coverage. So from our standpoint, from Ohio Consumers for Health coverage standpoint, it's extremely important that this bill be properly financed and that there be subsidies so that people whose incomes are up to 400% of the federal poverty level, which really is not that high, are able to get some help with their health insurance premiums. I would say that what we need now more than anything is for the American public to raise its voice and speak very loudly. People who have written to their congressman a while ago should write again. If you've written, then call your friends and ask them to write. We need the public, the Congress, to know that the public is fully behind healthcare reform and that it needs to be affordable healthcare reform so that everyone is able to be covered.
How long do we have to do something about this? I mean, there are bills.
The bills are pending right now. We're expecting to, the Senate has 2 bills that came out of 2 separate committees. They are being merged into one bill. Will probably hit the Senate floor late this month or early next month. The House 3200 did not have as much variation in what came out of the 3 House committees, but it also is being merged into one bill, and we're expecting that it will hit the floor by the late part of October or early November. There should be the floor debate pretty much through November. Hopefully we will see bills out of both houses, passed by both houses in November, and then there will be a conference committee which will have to merge the differences between the House and the Senate. Merged in December, and the merged bill will go back to each of the 2 houses to give final sign-off. Hopefully everything will be wrapped up by Christmas.
Oh, okay, wow.
Yeah.
And you expect at this point, whatever bill is formed, that it's going to have key provisions that a lot of people such as you have been looking for?
I anticipate that there will be provisions that will eliminate the discrimination based on pre-existing condition. I suspect that there will be provisions which will subsidize people to purchase coverage, and I also expect there will be provisions that will expand the income range at which people, the very poor, can get Medicaid, which right now is those levels are very, very low, and not everyone who is poor can get Medicaid. The categories that have kept a lot of people out of Medicaid will be essentially erased and merged so that if you're poor, you'll be able to get Medicaid. Those are changes I expect to see. Other changes that I would like to see are the broadening of the subsidies so that people would get the subsidy with a smaller percentage of their income having to go toward premiums and out-of-pocket expenses. And right now, those percentages are hovering around 10%, and I think expecting people at about 300 to 400% of poverty level to be able to spend 10% of their income on their healthcare premiums and on out-of-pocket expenses is way too much.
What about single payer? I hear a lot of people seem typically like on the left, so to speak, mention single payer.
Yeah.
But
It's, single payer is certainly it's not a proposal that Ohio Consumers for Health Coverage is supporting, and I'm the project director for OCHC, and that's really who I speak on behalf of. I mean, there's certainly much to be said for single payer, and a lot of concerns. I mean, it's not out there. It's not on the table right now. I would hate to think that the bills we have now would be thwarted because they don't reach the goal of single payer.
you have pretty good confidence in the bills that are being formed, that it's going to maybe not solve all the problems, but it's going to be a significant step in the right direction.
That's exactly right. That's what I would call it, a significant step in the right direction.
Well, thanks for talking with me.
Okay, you're welcome.
Right,
Thank
bye.
you.
I got to write
I
down your
don't
name.
remember your name.
Tom. I got to stop this.